The genetic testing that started that process is one that we followed for years now, but it's becoming a more viable option for anyone. 24-hour News 8's Adrian Broadus has a closer look at resources right here in central Indiana. Adrian.
Debbie, 1 in 8, that's the number of women who will be diagnosed with breast cancer at some point in their lifetime. That diagnosis came for one central Indiana woman a year ago, and she's doing all she can to prevent her daughters from getting the same devastating news. Rhonda Muncie was driving her Grand Am when she got a call that changed her life.
Driving down the road, and she says, can you pull over? I've got news. Yes, it's positive, you have cancer. And it was just like a whirlwind.
The mother of 3 had stage 2 breast cancer. She feared she would pass the gene on to her children.
For me, it was devastating to realize that as a mother, I had passed that on to her.
After her diagnosis, she and her kids came here to Community East for gene testing.
And we had it done and found out that it was 87%.
In each of those cells, we have what are called chromosomes.
Genetic counselors like Bekah Krukenberg help patients understand their medical options before and after the test. After a blood draw, results take about 2 weeks.
Also, there is a law in place so that insurance companies are not allowed to discriminate based on genetic information. I think that's important for people to know as well, just that you can't be dropped from your coverage because of the results of this test.
Muncie says her daughter Brittany opted for a preventive double mastectomy. That's the surgical removal of both breasts to reduce the risk of breast cancer.
We both had the double mastectomy and the reconstructive surgery 3 weeks apart. So she took care of me after my surgery, and in return I took care of her after her surgery.
And Debbie, several facilities right here in central Indiana offer the testing. She and her daughter had the testing here, as we mentioned, at Community East, and she's glad she did it.
How much did that cost?
Well, it all depends. It costs about $3,000, and if a patient meets certain criteria, your insurance company will pick up that cost. One of the big examples, if you have significant family history of breast cancer, or if 2 or more relatives in your family have developed breast cancer at a young age. And when we say young age, we mean younger than 50. But another important thing to point out, if you are testing for one known mutation, it's about $500.
All right, good to know. We'll have more on that tonight, 10 and 11 o'clock. Know a woman who did this. Hey.